As far as the upper eyelid, symmetry is extremely important. So we measure everything out with the fine ruler. And then when we're doing the surgery, we do want the patient slightly awake, not completely because we want you comfortable, but we'll have you slightly awake so we can test your muscle function during the middle of surgery. And so that's done with the patient slightly awake.
Slightly awake.
Yes.
That seems terrifying to me, but it's not.
You're pretty drugged up. So we'll have an anesthesiologist and they'll get you up and down as we need. Yeah. And for the critical parts, we'll have you wake up slightly and then we'll put you back down again.
I'm Susan Yara and welcome to My Life Online. We're going to have a lot of fun and learn a lot together. We've all seen that celebrities have really started to look great these days. And we know it's plastic surgery. Like, we are seeing these huge changes that are happening to a lot of, especially like the young starlets, but also, by the way, a lot of the men in Hollywood are all getting these really subtle treatments done to their faces, whether it's a non-invasive treatment or it's full-on plastic surgery. And a lot of the time what we hear about is the facelift. But what I think is really happening across the board is blepharoplasty, otherwise known as Bleph. And that is when they work on your eyes, whether it's the upper eyelid, the bottom eyelid, or both. This is a procedure that can really change the way you look. I actually think this is what a lot of the men are doing because it seems a lot more subtle too, but it just has a huge impact. So I'm calling it right now. I think this is a year of the Bleph. And to talk about it, I have Dr. Charles Lee here for this episode. He is a board certified plastic surgeon, but he has a fellowship in eye surgery specifically, and also specializes in ear, nose, and throat. So he does a lot of focus on the face area. So of course he can do the facelifts and all of that. But I have a feeling he's gonna have a lot to say about Blephs. All right, so let's start before we get into this super exciting topic. And I say super exciting because I'm doing a little recon myself, okay? But before we even get into this, tell us a little bit about your background.
Sure, I'm a board certified plastic surgeon. And I got additional training in eyelid surgery and anti-aging surgery of the face. So that's basically what I do in Beverly Hills.
I think a lot of people, like for instance, so I'm half Korean. I mean, my mom got eyelid surgery so early. And I think she was like 20, and that's like pretty old at that point, right?
It happens. Yeah, sure.
So I feel like Blephs have actually been really popular for years and years, at least amongst like Asians, right? But now I just feel like there's this explosion, and a lot of people don't realize it. We're seeing that facelifts are getting all the credit. But I feel like Blephs do so much more.
Well, Blephs is a necessary ingredient when you're getting a facelift, whatever, but the eyes are the focal point. So it actually usually goes the other way around. You start with the eyes and then you go, oh, you know what? I need this, I need that. And then turns into a facelift. But usually the starting point, ground zero, is usually the eyes.
Yeah. So explain to people that don't know, with a Bleph, it can be upper and lower.
That's correct.
Right? Yeah. But what are some of the specific things that you can be addressing with, let's start with the upper.
Upper, yeah. So this is the upper, this is the lower. Upper, as we age, of course, we get some extra skin, and then we get some sagging, and then the muscle that opens your eye also gets a little weak. So as we age, what happens is we look a little bit sleepy, we get the extra skin here, and then things droop, so things kind of sag. And that's what we try to fix with upper eyelid surgery. Okay.
And how is that different from, for instance, like the surgery that my mom got to give herself a little bit more of a crease?
Sure. In Asia, what's popular is about half the Asians don't have a fold, and it makes it really hard to put eyeliner on. So there's a surgery to what's called double eyelid, place a little crease so that it's easier to put eyeliner on. And that happens at a young age, 18, 20, et cetera.
Because it's just purely aesthetic. It's pretty,
purely aesthetic.
Yeah, and it's a pretty easy surgery, right?
Yeah. As easy as any cosmetic surgery can be.
Right.
Yes.
Fair. Fair.
Plenty of ways to screw up anything. Right?
I suppose. So with the Bleph, though, I guess take us through that process, because I think just because of the area that it is, it scares people to think that they would be doing something to their eye area.
Yes. One of the things we screen to see that your eyeball itself is healthy and all those things. As far as the upper eyelid, symmetry is extremely important. So we measure everything out with the fine ruler. And then when we're doing the surgery, we do want the patient slightly awake, not completely because we want you comfortable, but we'll have you slightly awake so we can test your muscle function during the middle of surgery. And so that's done with the patient slightly awake.
Slightly awake.
Yes.
That seems terrifying to me, but it's not.
You're pretty drugged up. So we'll have an anesthesiologist and they'll get you up and down as we need.
Yeah.
And for the critical parts, we'll have you wake up slightly and then we'll put you back down again.
Where do the incisions tend to be?
We try to hide it. So we'll try to hide it in your normal crease that's about 7 millimeters above this lash line.
Okay. I've seen online, you might hate this, but I'm curious to get your take, that people have been doing blephs where they're like doing the incision kind of around the brow.
Yeah.
What do you think about that?
Well, so the original invention was with the incision above the brow to lift it. But that operation really fell out of favor because the scar is very noticeable. More recently in Korea, what they've popularized is making the incision on the lower end of the brow. And that seems to hide the scar much better. I've done a few of those. I think it's okay, but it's got a longer learning curve for the surgeon, so it's not as popular here.
Right. And if your brow starts to sag or you get Botox, that kind of changes your brow.
Yeah, exactly. Yeah.
It might not be exactly what you want.
It's not a stable foundation. Yeah.
So you're going in and removing skin?
For the upper eyelid, typically removing some skin and also tightening up the eyelid muscle so that your eyes are opening and you look alert, which is something we lose as we age. So we fix the muscle at the same time, remove excess skin, and then preoperatively we'll assess your brow position. So a younger patient, let's say under the age of 45 typically, the brow is not bad. But as we age, the brows will start to really get loose. And so we have to stabilize that. So typically we'll stabilize it with the endoscopic, small scalp incision, endoscopic lift, to either stabilize the brow or rotate it upward slightly.
Interesting.
So it's frequently done together with the upper eyelid surgery.
Okay. Okay. And is there like a demographic, like an age demographic that tends to get upper eyelid bleph?
So the upper eyelid bleph, you'll see a younger group. So let's say under the age of 35, and they can probably get away with just eyelid surgery. After that, it varies, but a lot of people do need a brow stabilized or lifted at the same time.
Do you think, like people are going to Korea to stack their treatments, right?
Yeah.
Do you think it's sometimes better to just go ahead and just get it all done? Like everybody's doing, what are they calling it? The trend, it's like the everything surgery, right?
I mean, I wouldn't complain if they came to me and wanted everything done.
Yeah.
But in terms of, I think it's a personal choice.
Yeah.
Some people like to do a little at a time. I prefer to see the patient have some experience before I'll do a complete makeover.
Yeah.
Because you have to know what surgery is like. And if you've never had surgery, it's a little too much, I think, to do everything all at once.
I mean, I'll tell you, I got my nose done. I had my filler removed, my HA filler removed, and then had fat grafting put in at the same time while I was under. And I looked like a mess for an entire week. And I started feeling anxiety around it, even though the plastic surgeon had warned me. And I knew, because I've been in the industry, I still couldn't get over my own thoughts of just like looking at myself and thinking, what did I do?
That's right. That's right. I mean, it's scary to see yourself all beat up.
Yeah.
And you don't know if things that you're feeling is something normal or it's not normal. And so people have different levels of anxiety. And so that's why I really prefer to see somebody that's had something done. Yeah. So if you haven't had anything, I would recommend maybe tiptoeing in a little bit, do 1 or 2 procedures and see how, if your psychological profile is such that you can tolerate surgery.
Yeah. See, I used to be of the mindset that I was going to do these like baby tweaks throughout like my 40s. Yeah. And here I am in my early 40s and suddenly the baby tweaks even sound scary to me. But it's more so time, right?
That's
like
true.
It's kind of like, okay, am I going to take the time out to really like get one thing done and then go back in and do another thing? So now stacking seems like the better option. Yeah. But then it becomes, okay, when do I have the time to do all of this and like be out for a week or even for a month or something, right? Yeah.
So I think in the 40s and maybe even early 50s, you can do 2-3 procedures and stack some. When you're in your 60s, when you're my age, you got to do like everything all at one time.
Or you just look different, like disproportionate.
Right. Things don't match. So I think a younger person like you have time to do a few things at one time. Okay. And without having to do everything.
You mentioned the muscle, which I think is really interesting. And it's a conversation I'm starting to notice plastic surgeons talk about now more so, just in general, when it comes especially to the face and even the neck and, the way that they're doing facelifts. I feel like muscle placement wasn't as important back in the day. It was about like taking the skin and stretching it back, right? Or like the layers.
No, absolutely. Yeah, absolutely. With facelifts especially, it's because the anatomy of that area wasn't worked out. very well until relatively recently.
Yeah.
So we were just afraid of damaging the facial nerve. But that anatomy has been worked out really well over the last 10 years or so. And that's why there's more of an emphasis now on muscle and less so on the skin.
Interesting.
Yeah.
Because our muscles are moving in our eye area and in our face and
yes,
everywhere.
In the face, when you're pulling, the muscle is a much more stable foundation to do your pull. The skin's a little too loose. And so you start getting a windswept look or distortions in the anatomy. So that's why we've been moving deeper and deeper. And it's only been limited by our understanding of the anatomy, which has gotten quite good in the last few years.
Yeah. So then there's this muscle in our eyes that you're correcting in the bleph.
Yeah, in the eye. I think the reason why eye muscle has been more emphasized recently is there's been a convergence of different specialists. And in the past, cosmetic eyelid surgery was exclusively in the domain of plastic surgeons. And now the ophthalmologists are fantastic and they know the anatomy so well.
Yeah.
And so we shared our ideas and there's much better understanding of the eyelid because of this cooperation between the ophthalmologists and the plastic surgeons.
Oh, I love when we work together as a community.
Yeah, absolutely. Yeah.
That's so nice. I actually think it's interesting for you to say that you like to combine the brow lift with the upper bleph. So explain endoscopic, because I think that's also something that people don't have a full understanding of. And actually, it wasn't until a friend who went to you recently got an endoscopic facelift that I realized you weren't taking this person's skin off. You were going in and fixing the muscles.
Yeah, it's the endoscopic. So we started with the endoscopic brow lift, which means we make a 1-inch incision in the scalp area and then use a TV camera to look at the anatomy as we're doing the dissection.
Like a little tiny camera goes in.
It goes inside and we can see it through a TV screen.
And how big is the incision?
About 1 inch.
So it's small.
Yeah, very small. And so that was used in the brow area. More recently, people have expanded that to now go into the face. And so we don't have to make cuts around the ear. We can do all of that through the same temple incision and see the anatomy carefully and do all the dissection without the scars.
Interesting.
And so that's relatively recent.
Is this why a lot of celebrities are suddenly just like on the red carpet and we're like, what? Wow,
exactly.
This person looks fantastic.
I think that's what Lindsay Lohan had done.
Yeah.
I don't know that for a fact, but looking at it, it looks really like an endoscopic deep plane mid facelift.
And so they can go deep plane like that.
They can, yeah. Wow. Yeah, it's just relatively recent, but it's kind of exploding right now.
Okay, interesting. Let's go back to the bleph.
Yeah.
What is the healing time of an upper eyelid bleph?
Well, I would say 10 days. Most people feel okay by 10 days to go out in public.
Okay.
If you're in front of the camera or you want to look good for some special event like a wedding, probably 3 weeks to be safe.
Okay.
You can do remote work at home. At even 3 or 4 days. But if you don't want to scare people, I'd probably say 10 days.
The lower eyelid bleph, I feel like that's like I saw what you did with Chriselle.
Yeah.
And it was fantastic. I got to see her in person just like a few weeks later. And I didn't even know. I knew something looked different.
Yeah.
And she had told me that she had dissolved all her filler and she hated it. Because she called me and she was like, I saw that you dissolved your filler. So I went to dissolve my filler.
Okay.
And now I hate it.
Yeah.
So she called me before she actually went to you. And she was like, what should I do? And I was like, ooh.
Yeah.
I was like, well, I've been doing treatments like Renuva and all that kind of stuff, but it's slow.
Yeah.
Like you're going to have to be patient, you know?
Well, Chriselle's been wonderful about sharing her experience. Yeah, the lower eyelid, that puffiness comes from swelling of the fat here. Now, some people get it at a very young age. So even in your teens or 20s, especially if you have allergies, that fat tends to bulge out. And so we can take care of that by going in through the undersurface of the lid, so the scar's hidden. And then we can redistribute the fat so that it's smoother and there's not a sharp demarcation between the end of the bag and the start of your cheek. So that's why we call it redistribution. There's sometimes some extra skin. Okay. So if necessary, we'll pinch off a little bit of skin and hide that scar right underneath the lashes.
Interesting. Yeah. Is there a difference in the healing if you're not pinching off any of the skin? And is it literally called a skin pinch?
It's literally called a skin pinch.
Okay.
I think the healing time's not so much dependent on whether you take the skin out, but it depends on whether you bruise easily. So about 10% of the population bruises really easily. And when you're doing a lower lid, that bruising becomes very noticeable. So if you're in that 10% group, and you know who you are because your menstrual cycle, you'll bleed a lot or any little bump and then you have a bruise. Those people, you probably need to add about another week of recovery time.
So you're saying whether it's an incision or not?
Yeah, the dependent factor to me for recovery on the lower eyelid is whether you bruise easily.
Okay.
Yeah.
Here's where my recon is coming in. So I'm one of those unfortunate souls who all the neurotoxins have kind of stopped working on me.
Okay.
Like I'm starting to, and now I'm like in my last, like the last depths of it. Like I've tried every single brand, right?
Okay.
And it's working a little bit, but my crow's feet, you can't get them to go away completely anymore, right?
Okay.
So would I be a candidate for like a skin pinch?
Well, if the crow's feet, if it's out here, it's going to be related to maybe the descent or the brow coming down.
Okay.
And so if you do eyelid surgery by itself, it can actually make the problem worse.
Ooh, that's good to know.
Yeah. So this will actually come down a little bit. So if crow's feet bother you and Botox is not an option, then I would recommend a temple lift or a brow lift to open this area up a little bit.
Oh, that's so interesting.
Yeah.
Temple lift. Now when I'm learning
yeah.
a new procedure, I guess we can lift everything, right?
Yeah.
Technically.
Yeah, absolutely.
Do you feel like with this like popularity right now of all these regenerative injectables, right? Like the PRPs, the growth factors, the Sculptras, the Renuvas.
Yeah.
And again, asking for a friend.
Yeah.
Do you think that these cause more complications when we now go in for something like a bleph? Like if we're getting it done all in this area, is this going to cause a complication later?
It depends on the material. So I think the exosomes and the Rajuron, those are, I think, okay. Sculptra and Radius tend to leave a little residue of scar. And that makes the surgery a little bit more difficult.
Yeah.
It makes the different planes, surgical fields, a little bit harder to unstick. So with those types of treatments, Sculptra or Radius, we usually want to wait about a year, maybe even 2 years before doing a procedure.
Oh, got it. Like to let it really settle and see where it's at.
Yeah, to let it settle and make it easier for us to operate.
Interesting.
Yeah, but the other stuff's okay. Exosome or even fillers, Botox, all of that's okay.
Even though we've been saying that, with x-rays or whatever, ultrasound, that HA fillers can stay in the lower eyelid area.
HA fillers doesn't leave so much scar tissue. When I go into an area that's had filler, when you open it up, you just see filler come out. Yeah. But the tissues themselves are not damaged. Yeah. But when you use something like Radius or Sculptra, the tissue actually looks damaged.
All right. So how often do you think people, do you recommend most of the time that people just get upper and lower bleph right away? Or it just depends?
It really depends. I would say if fillers work for you, I would probably use that until you get to the point where it doesn't work anymore.
So who are the proper candidates for that lower bleph? Because you're talking about these fat pockets, but I think I've seen people that almost even look hollowed out.
Yeah, a lot of times they've had surgery. Sometimes I'll look and I'll go, you've had surgery, and they go, oh yeah, I forgot.
Oh yeah.
Sometimes people just forget,
what?
that they had it.
What do you mean?
Yeah, they just forget they had it. So I think it's there comes a point when the fat bags get a little too big, and you can't disguise it with filler. So that's one time I would do it. Some people don't want to do filler because you have to do it periodically, every maybe year and a half or so. Yeah. Aesthetic surgery is whenever it bothers you. And the surgeon can see the same problem you see, and they feel comfortable that they can do the surgery and get you the result you're looking for. Sometimes I see the same problem the patient does, but I don't feel that I can accomplish it because it's so small, so trivial, right? So that's not the time to do it. But when the surgeon can see it, you can see it, and they feel like they can fix it for you, I would do it at that time. All
right. So back to me. So I'm now starting to realize that I'm not the skin pinch candidate then maybe, right? Because you're saying that it could potentially make it worse.
Well, I think lower lid's okay. So I think of crow's feet as the brow.
Oh, interesting.
Yes, I think of it as this coming down, which it does come down for all of us. Okay. And but if it's the lower lid, it's not going to crowd this area.
Because what are we cutting then with the skin pinch?
You're removing maybe 2-3 millimeters of skin. It's this excess that you can
that you
kind
can
of
pinch.
yeah. That
Yeah.
you're just trimming it.
And then does it make your, this is
I wish this would lift,
Would it
right?
lift
That's
it?
what everybody
No!
wants. Everybody wants this, but
so my smile line wouldn't disappear suddenly.
no. See, unfortunately, that is a deep plane facelift.
Okay.
Yeah, deep plane facelift.
Do you get asked this a lot?
Well, everybody says, while you're in there, can you just do this for me? Like, I can, but it's a deep plane facelift.
We're talking a whole other surgery, a whole other recovery, right?
Yeah.
What is kind of the difference between, I guess, like the popular restorative, facial procedures and the healing time? Like brow lift, bleph.
Yeah, I think your first procedure is going to be 10 days, maybe 14 days to recover. And every procedure you put on top of that might add 4 or 5 days. So maximum I would say is 3 weeks.
Okay.
If you do everything, I think 3 weeks, people look okay.
Yeah. So when you can go out, probably 10 days, like you said, or 3 weeks if you really don't want to scare people. But how about the actual healing? Like I know with the facelift, for instance, you get numb sometimes and you're swollen. Nose job. I had a swollen tip for it felt like 2 years actually.
Yeah, that's probably right. Nose is probably 1.5 years, 2 years. With the lower lid, you're not going to see too much difference between 6 months and a year. Upper eyelid, if you have the issue with the muscle, that can take up to two years to improve. I've actually had a patient look very uneven for a good 1.5 years. And then she was mad at me, wouldn't talk to me. I didn't see her. And then like 2 years later, she came back and said, oh, look, it looks good now. So now I know, 2 years.
Okay.
Yeah. You can have numbness that can take up to six months. Usually 6 months it comes back.
And like the nerves kind of reattaching and all that too?
Yeah, there's some sensory nerves that are unavoidable. You just have to go through it. And those take about 6 months to 12 months to come back. Okay. Yeah. If you're doing facial bone surgery, maybe 1 month.
How often are people doing facial bone surgery? Is that pretty popular?
It's popular in my population, which is every surgeon has a little different population. 1 out of 10 patients are getting some bone surgery.
We're talking an Asian population.
Yeah. Bone surgery to shave some bone.
Yeah.
Basically.
We like to have little faces.
Small faces.
We like to be petite.
But it's interesting. The aesthetic goals that I grew up with have changed a lot. So now even in the West, we talk a lot about V-line and making a skinny chin and softening the features, which 20 years ago, that wasn't the case.
What was it 20 years ago?
20 years ago, people were trying to make everything more angular and more strong. And so really strong cheek and jaw line was popular. But now I see more of a softer look that's coming in vogue.
Interesting.
And I think it's kind of a confluence of different cultures.
Yeah, that makes a lot of sense. Yeah. Do you feel like plastic surgery, especially facial plastic surgery, is back on the rise? Because I feel like for a second there, we were doing all the non-invasive stuff.
Yeah, absolutely. Yeah, I think so. I remember when the fillers came out and all that stuff about 20 years ago, facelifts and anti-aging just died as a surgical specialty. It just died. And so everybody was doing breast augmentation, et cetera. Now there's kind of a backlash against all these fillers, like the MRI scans you're talking about. Right. People are getting scared because all of this stuff hangs around a lot longer than we thought.
And we start realizing like our faces are looking a little bit puffy.
Yeah. It happens gradually, but if you go every 6 months to get filler, you're going to be overfilled. So I think there's a whole backlash now against that, and people are going in and getting everything removed and then starting all over again. And then they're like, you know what? I don't think I want to do filler this time. So I'm seeing a big uptick in anti-aging surgery. And fat grafting also is taking some of the filler business away.
Yeah. Because
fat grafting has stem cells in it.
Right.
And with stem cells, you're actually like making the skin just more younger, because the stem cells are baby cells and you're getting fresh skin as opposed to just filling it. So I think the stem cell fat grafting has really taken volumizing to another level.
Got it. Yeah. You know what's funny is I had that fat grafting that I told you about, but this is now a few years ago. This is like in the height of like pandemic when everyone decided to start getting surgeries because we're like in lockdown.
Oh yeah, I remember.
But I felt like it was like month 2. I was like, this is fantastic. I love the way it looks. By month 4 or 5, I was like, where did it go?
Oh yeah. I mean, you do lose anywhere, I think probably 40 or 50%, maybe even more. So when procedures are invented, the inventor will say, oh, this is 100% perfect, right? And then the rest of us do it and go, you know what? Maybe 50%. So you do lose a lot, but there's some residual effect that's very real.
Like the stem cells.
Yeah.
And that makes a lot of sense under the eyes.
Yeah. It takes away the discoloration, which before we didn't really have a good treatment for.
That makes sense. All right. So now we know everyone's unhappy. We've spent too many years and too much money on all the non-surgical stuff. And now we're coming back. We're like, fix our faces after we've like done too much to it.
I don't want to make enemies out of my injector colleagues. I have some great friends that are. But we're kind of seeing more of a balance now.
What is probably the most popular procedure you're doing lately in your practice for the face or face area?
Yeah, I think the eyelid surgery has always been there, and I personally do a lot of rhinoplasty because that's my background in ENT as well. So those are two big things that I mainly do.
And then when it comes to the facelift, what's the most popular facelift you've been doing?
Well, I personally I love this endoscopic lift. I mean, it saves a lot of time in surgery because you don't have to spend an hour closing a lot of cuts. The other thing is the incision around the ear. It's actually really hard to disguise.
I mean, I think I see it all the time.
Yeah, you see it all the time. It's very visible. And even if the surgeon does a great job in closing, as you heal, some of that skin stretches away from your stitch line. And that's when you get a little widening of the scar.
Yeah.
So it's very hard to hide that scar, but with the endoscope, you're avoiding it altogether. So I'm super excited about this procedure.
But do you end up having like lost hair or anything in the incisions?
No. So the way we avoid losing hair is we don't remove any scalp tissue. We let it bunch up. So you're taking a lot of sutures and suturing things together. And then you'll have some redundancy in the form of a bulge in the scalp.
Okay.
That you can't really see it, but you can feel it.
Okay.
And we let that bulge go down over time.
Yeah.
So there's no missing tissue, so there's no stretch, and there's no loss of hair.
Yeah. Do you get, I guess, well, let's talk about like the potential risks and everything too. I've noticed that when people get any kind of lift, sometimes they'll get like rippling when it comes to skin, right?
Yeah.
So are you kind of avoiding that rippling effect with your face too?
With endoscopic lift, all of that extra skin and tissue is moved backward into the hair, inside, beyond the hairline. So any rippling and all that, if you shave it, you're going to see, okay, I can see all the excess skin and the bulging and the distortions. But because we're not bald, you can't see it. And then over time, all those things smoothen out. So I think it's really revolutionized what's happening with facelifts.
Yeah. So really, it's the endoscopic facelift and those blephs that are taking over the red carpet.
Yeah, absolutely.
With the bleph and with a facelift, what are some of the things that people should know? Like, could there be some asymmetries and stuff?
With the blephs, especially the upper bleph, asymmetry is the biggest issue. So, I would say any of these procedures has about a 10% revision rate. Possibly 20%. Eyelid muscle issues, maybe 30%. So upper eyelid, if they're even to start with, don't worry. But if they're uneven to start with, then the chances that you're going to end up uneven is relatively high. So maybe 20%, 30%.
Okay.
It's not hard to fix, but it is a revision. It's a hassle. You got to take off time again.
Got it.
So that's the big thing with the upper lid. Lower lid, most people are okay. Certain people that have the eyeball a little bit forward, so they kind of bulge out a little bit. They're at higher risk of scleral show or distortion of the lower lid, a little bit higher risk for that.
Okay.
So the surgeons, the experienced ones we're always looking for those problem ones. And we'll either advise them that we'll have to undercorrect or maybe even just not do the surgery.
Oh, interesting.
So the eyeball position is really important.
I hadn't considered that. If people have HA fillers or any of that stuff, do you make them dissolve it first?
I strongly prefer.
Okay. Is there anything else that you think that people should know when it comes to bleph?
So with the lower lids especially, surgery can correct the excess skin. What we can't correct is the fine wrinkling, crepey skin that some people have. And for that, you really have to do something like laser or chemical peel. That's a non-surgical problem.
Do you sometimes do it at the same time?
We will do it sometimes. My population doesn't do well with lasers. So I'll tend to use peel or refer them to a dermatologist.
Your population being me as the demographic, because I definitely don't do well with lasers. I have like trauma from like trying out lasers in the past.
Lasers, yeah, that's a whole other topic. Lasers, I'm scared of.
Yeah, me too. Me too. Yeah. I've had some successful moments going to the right doctors, but it can be really scary, especially when you have fair skin, but you know that you've got that melanin underneath that could arise. Yeah, for sure. Well, thank you so much. This was very enlightening. I'm going to probably cross Bleph off of my list, but I'll come back to you for the endoscopic facelift when I'm ready.
Well, I mean, you actually don't look like you need anything. Your skin, maybe the fat graft really helped a lot because that skin quality is excellent.
I mean, I keep getting things done all the time. so we can't just credit the fat grafting from 4 years ago. There's like Renuva in here. There's all these other things. I've gotten so much. So but thank you. I appreciate it coming from you. Where can people find you online?
TikTok, Instagram, Dr. Lee 90210.
Okay.
So that's how most of them know us.
Yeah.
Through our Instagram and TikTok.
I mean, you're hilarious.
Yeah, thank you
on your
so
social
much.
media. I love it. Well, thank you so much.
Okay. Thank you very much, Susan.
Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.